So, in light of the recent tragic events in New York and Texas, I thought I would make a video going through some data and research on gun violence, especially in America. And it may have some information that you may or may not be aware of. It's going to be kind of a long video, but I think it's an important topic. So, if you're interested, stay with me. I'm going to start with this first paper, which was recently published before these events occurred, and the research was done months before, but it was published in April 21st, 2022, in the New England Journal of Medicine. And this is a group out of Harvard that does public health research on guns. And they said that they report that as of 2017, there has been an inflection point in what the number one cause of death amongst children, adolescents, and young adults is. So for a long time, it was motor vehicles. Motor vehicles were the single most common cause of death in this age group. This age group is generally very healthy and they have a very low mortality rate. They're not dying of cancer or heart attack very often or stroke. They don't have any of those events. So injuries, especially motor vehicle crashes, were the number one. But over the past several years, motor vehicle crashes have been going down, and recently firearm-related deaths have been going up. And at 2017, they've reached an inflection point. In this article, they mainly talk about how public health measures have improved motor vehicle safety and decreased motor vehicle deaths, and neglect of firearms has reduced public policy decisions and meaningful research into this area to drive good public policy, and they feel like that may be why there's this inflection point. So they were celebrating this slope and sad about this slope. This is an article from the Pew Research Center talking about gun deaths in the United States. There were 45,000 people that died from gun-related injuries in 2022, and this is only taking into effect where gunshot injuries were the principal role of death, not a contributing role, but the principal role. If you look at this, you'll see that the vast majority of these gun deaths are actually suicide. So suicide is actually the most common gun-related violence. It's violence to self. Suicides, and then murders, and then 3% are other, meaning it was either a law enforcement death or unintentional uh, death from guns. So while suicides don't get much media attention, they are the number one reason for gun violence. And then 80% of U.S. murders involve a gun, and a little over half of the suicides involve a gun. And the gun deaths in 2022 were the most on record. However, if you adjust it by population, the most gun deaths by murder were back in 1974, and the most gun deaths by suicide, adjusted for population, were back in the 1970s, both of them. And then gun death rates varied widely by state. And then this, I think, is the thing that I was most interested in, because I kind of was interested mostly in the research on mass shootings, because mass shootings are what get the most media attention, and every time there's a mass shooting, it gets a lot of media attention. So as you can see from this graph, mass shooting incidents, active shooter incidents, are defined. This is by the FBI definition of an active shooter incident, where you have someone in a public area attempting to shoot more than one person. And so if you look at this from 2000 to 2020, you can see that there is a definite upward trend in the number of active shooter incidents. What are the most common types of guns used in murders? Handguns are in 59%, and rifles are in 3%. Rifles include these things that are often referred to as assault weapons. Assault weapons are not really a specific term. It's not well defined, but usually means a rifle that uses a semi-automatic rifle that uses a large capacity magazine. Okay, so do we have mass shootings? Do we have more mass shootings in the United States than other countries? Well, it's a little hard to define because the definition of a mass shooting is different based on the different databases. But if you define it as shootings where more than four victims die, and you look at this data set of 6 years and you adjust it for million people population, you get a data set that looks similar to this. If you look at this data set, it doesn't look like America is doing too bad. We're number 11 on this list. Norway is number 1 at 1.8. However, this is a bit of a misleading data set because it only captures 6 years, and some of these countries had just one event that had a large impact on this number in this time frame. For example, Norway, which is number 1, this is all from a single incident in 2011 when 69 people were killed at a summer camp on this island. They've had no other mass shootings in that time span, and they've had no mass shootings since 2015. So a better way of looking at it may be to look at median number of mass shooting deaths. If you look at this, then you see that the United States is 0.05. The other thing to note from these numbers is that mass shooting deaths are extremely uncommon. Your risk of dying in a mass shooting event per year is less than 1 in 10 million. That is, but if you poll Americans, about 80% of Americans are afraid of mass shooting events. They're personally afraid of them. However, your risk of dying in a mass shooting event is extremely low. It's less than 1 in 10 million by either metric. If you look at by the mean, it's 0.08. If you look at median, it's 0.05 in the United States. Now, look at the median numbers for every other country. Essentially zero, because almost every other country only had one event in the past 6 years. America has an event, at least one event every year. So therefore, there's a median coverage. Now, if you look back at a bigger data set that's much better, this is a data set looked at by Adam Langford, who is a researcher out of the University of Alabama. He looked at public mass shooters in 171 countries. And if you look at this, between 1966 and 2012, approximately 31% of global offenders attacked in the United States, whereas 69% attacked in every other country. So America has 4% of the world's population, but has 31% of the world's mass shooting events. So that's an overrepresentation of about tenfold. So they have about 10 times more mass shooting events than the average country. So what are the reasons that may be the case? Many people believe that it's mental illness, and it's true, you have to have some kind of mental illness to be a perpetrator of a mass shooting event. But does that explain the outlier status of the United States of having 10 times more mass shooting events than the average country? This is a study from the Commonwealth Fund looking at mental health issues in high-income countries. You can see America is the highest amongst this data set, but it's not 10 times higher. It's 23% versus 20% in Canada and Sweden, and then 16% in Norway. Self-reported distress, America is number 2. Um, and then if you look at what's causing the distress, it is neighborhood, it's safety issues and economic issues. America has high levels of anxiety and emotional distress driving mental health issues due to socioeconomic stress. These other countries have more robust safety nets, and they report lower rates of socioeconomic stress. So what are the highest rates of depression? America is not an outlier. You can see that America is fairly high at 5.9%, but it's tied with Australia, and it's just less than 1% off from many other countries. So it's not we don't have 10 times the amount of depression of other countries. And then if you look at youth, um, in terms of who is more depressed and anxious, women are adolescents are more distressed than male. However, most shooters are male. So mental health affects people differently. This is a paper out of um, the Harvard Review of Psychiatry looking at mass mental illness and mass shootings. And they're basically saying, okay, so let's read it together. The indiscriminate shooting rampages in public accounted for approximately 0.5% of homicides in the United States. So it's less than 1% of murders are mass shootings. And again, your risk is less than 1 in 10 million. Yet an estimated 71% of Americans experience fear of mass shootings as a significant source of stress in their lives, causing 1 out of 3 people to avoid certain public places, according to a national survey by the American Psychological Association. So yeah, people grossly overestimate their risk of dying in these mass shooting events. I guess it's kind of like how I have a fear of sharks, but it's very unlikely that I'm going to get attacked by a shark. But it is I think of it every time I go to the beach. Um, these events are very psychologically scarring, and so I think it makes a big impact on people, even though the statistical risk is very low. So, on one hand, the public's a priori definition of mass shooters as seriously mentally ill invites and reinforces unrealistic expectations that mental health experts should be able to predict and prevent acts of mass violence. It tends to inspire public support for restrictive policies and interventions targeting psychiatric patients. On the other hand, a deranged shooter story can give mental health professionals a powerful voice and audience. People look to them for answers and solutions, which translates into opportunities to reframe the debate over what should actually be done about mass shootings in the United States. So they're saying people just feel like, oh, these are mentally ill people, and if we just treated them, then we wouldn't have these problems. Um, and then they also stigmatize people with mental health issues. And they're saying that that's not true. That's not a good way of looking at it. What can psychiatrists and other mental health clinicians, researchers, and policymakers do to foster evidence-based solutions to prevent mass shootings and to mitigate the population risk of firearm injuries in general without adding to the burden and stigma and social rejection of people who are recovering from mental illness may feel when others assume that they are dangerous? Existing scientific evidence paints a complex, if incomplete, picture of the causes of mass shootings and other acts of serious violence. Until recently, a congressional ban on federal funding for most gun-related research has prevented scientists and scholars from conducting the full range of interdisciplinary studies that would provide a better understanding of the problem and point the way to effective solutions. So yeah, interestingly, there has been a federal ban on funding for research into guns, which is confusing. First, researchers must abandon the starting assumption that acts of mass violence are primarily driven by diagnosable psychopathology in isolated lone wolf individuals and must rather situate such destructive motivations within larger social contexts. Okay, there was another part that I remember reading in here that I want to point out to you. But yeah, here, this is an important Uh, retrospective analyses suggest that a non-trivial minority of high-profile mass shooters demonstrated clinical symptoms, including paranoia, depression, delusions at some point in their lives. Still, the assumption that mass shootings are driven solely or even primarily by diagnosable psychopathology stretches the limits of mental health expertise. It sets up a false expectation that advancing neuroscience and better therapies to manage psychiatric symptoms will provide the answer to solving gun violence. There is no existing or forthcoming unified theory of impaired brain functioning or of cognitive mood or behavioral dysregulation that could adequately explain mass shootings or multiple victim homicides. So they're basically saying, look, we cannot predict these with good accuracy. This is another paper by Lisa Gold, who is a psychiatrist at Georgetown University, talking about mass shootings and gun violence. So she talks about suicide and gun violence, which we know from the previous Pew Research Center information is the number one cause of the number one effect of gun violence. All right, so here we go. That more research is needed to identify causal factors of gun violence and the effects of interventions to reduce or prevent it is undeniable. Nevertheless, available data point the way towards effective public health interventions to reduce gun violence. These data indicate robust correlations, not between mental illness and gun violence, but between the prevalence of guns and gun violence. Okay, now you have to understand that these are correlations, not causations. The current research is not strong enough to say that having lots of guns causes gun violence. There is a strong correlation, however. There is no correlation between mental illness and gun violence, however. This research has consistently demonstrated that where there are fewer guns, there is less gun violence. For example, a 2003 report suggests states that restrict weapons have the lowest per capita homicide rates. A recent state-by-state study using data from the CDC, FBI, and ATF found that many states with the weakest gun laws have the highest rates of gun violence. Another study found that states with the strongest gun laws had a lower overall firearms-related fatality rate both before and after controlling for other state-specific socioeconomic factors, and that states with stronger gun laws had lower gun-related suicide and homicide rates. Okay, so and then in contrast, there is little evidence of any kind to suggest that gun restriction policies for the seriously mentally ill actually prevent the small subgroup of dangerous individuals with mental illness from committing acts of violence. So her position is that mentally ill people are not necessarily dangerous. There's a small subset of them that are dangerous, and they don't have the research or the information to know which proportion of them are dangerous. Because if you just say all mentally ill people are dangerous, that's like almost 25% of the population. Other studies show that in teenagers, up to 25% of them have anxiety or depression, mental illness. So that's a high, high number. But obviously, mass shooting events are extremely uncommon. So there's a very, very small subset of these people that are dangerous. This was a very interesting study published at the National Institute of Justice, which is part of the Department of Justice, talking about mass shootings. So they looked at data from 1966 to 2019. So that is 7 more years of data from this Langford study, which went to 1966 to 2012. In this one, he found 90 mass shooting events in the United States. In this one, 172. So in the past 7 years, we've added 82 mass shooting events. So the trend is obvious. Project spanned mass shootings over 50 years, yet 20% of the mass shootings occurred in the last 5 years of the study period. More than half occurred after 2000, and 33% occurred after 2010. So you can see that this trend is definitely accelerating. The number of mass shooting events is definitely going up in recent history. It's not just media talking about it more or just our perception of it. It is actually what is occurring. 16 of the 20th deadly mass shooting events in modern history occurred between 1999 and 2019, and 8 of those 16 occurred between 2014 and 2019. And we know so far this year it has already been bad. So they're looking at the study design. Again, their metric is greater than 4 people constitutes a mass shooting event. Okay, in public discourse, mass shootings are often blamed on mental illness, but research indicates the role of mental illness in mass shootings is complicated and not clear-cut. Mental health issues were common amongst those who engage in mass shootings, with psychosis playing a minor role in nearly 1/3 of the cases, but a primary role in 10% of the time. Data indicate that nearly all people who engage in mass shootings were in a state of crisis in the weeks or days preceding the shooting. This is obviously true. You know, you have to have some kind of mental instability to be a mass shooter. That's obvious. Nearly half of the individuals who engaged in mass shootings leaked their plans in advance to others, including family members, friends, and colleagues, as well as strangers and law enforcement officers. Legacy tokens such as manifestos were left behind by 23.4% of those who committed mass shootings. About 70% of individuals who perpetrated mass shootings knew at least some of their victims. In particular, K-12 schools and workplace shooters were insiders, current or former students and employees. That finding has implications for physical security measures and the use of active shooter drills. The fact that leakage is a common occurrence with mass shootings provides an opportunity for intervention. Notably, most individuals who engage in mass shootings use handguns, 77.2%, and 25% use assault rifles in the commission of their crimes. So when we hear the media reports about mass shootings, we almost always talk about, quote, assault rifles, most usually AR-15 style rifles, but they are used in the minority of the cases. Of the known mass shooting cases, 77% of those who engage in mass shootings purchase at least some of their guns legally. So I think this is a very important statistic. Most of the mass shooters purchase their guns legally, and illegal purchases were made by 13 of those. In those cases involving K through 12 school shootings, 80% of the individuals, who are usually adolescents, stole the guns from family members. These findings support safe storage of guns, yet the researchers noted that there are no federal laws requiring safe storage of guns and no federal standards for firearm locks. So these would have theoretically prevented many of the K-12 shootings where the adolescents stole their guns from their family, and better control of who can legally purchase a gun may have prevented some of these. And then mass shooting demographics. Of the 172 individuals who performed mass shootings, 97.7% were male, so almost all male. Mean age of 34, ranging from 11 to 70. Most of the mass shooters, I believe, are in their 20s. They were mostly white, followed by black, followed by a minority of Latino, Asian, Middle Eastern, or Native American individuals. Most of them had a prior criminal record, history of violence, including domestic violence, and 28% had a military background. Most died at the scene of the crime, with 38% committing suicide and then 20% being killed by law enforcement. And then when they interviewed the few that did not die at the scene, you can't generalize very well because they just only had 5 interviews, but they shared these following traits: early childhood trauma and exposure to violence, identifiable grievance or crisis point, validation of beliefs by finding inspiration in past shooting by others, and then the means to carry out an attack. So they had access to a means to do it. Okay, so going back to this Langford study, what he did in this study was he tried to figure out, why is the US an outlier? Is it just because we have higher homicide rates? Do we have higher suicide rates? Or do we just have higher gun ownership rates? So he looked at the regression for those things, and he found that homicide rates and suicide rates are not significant. So if it was mental health issues that caused the United States to be an outlier, you would expect that we would have outlier suicide rates, because suicide rates correlate very highly with mental health issues. However, that was not the case. And then they also took the US out and compared just the other countries and saw if the correlations held, and they did. So let's read the discussion together briefly. How can the global distribution of public mass shooters be explained? National homicide rates do not seem to explain cross-national difference. Some of the most dangerous countries in terms of homicide risk, such as Venezuela, Nigeria, and Mexico, had very few offenders. So these places, there's lots of murders, but they have very few mass shooters. In retrospect, perhaps this should not have been surprising, because public mass shooters tend to differ from other murderers in several fundamental ways. Public mass shooters are commonly mentally ill or suicidal, but most homicide offenders are not. Public mass shooters often plan their attacks in advance, but other murderers are much more likely to commit crimes of passion or escalation. Although public mass shooters often kill random strangers or bystanders, most murderers do not target strangers unless there is something tangible to be gained, such as stolen goods or money. National suicide rates also fail to explain the global distribution of public mass shooters. In retrospect, this also seems to make sense. Although mental illness can exacerbate many personal problems, the vast majority of people who are mentally ill and suicidal are non-violent. So those are the same things that the previous two psychiatry papers were talking about. Compared to typical suicides, mass shootings are so rare that it is not surprising that these two behaviors do not appear to be correlated. Perhaps more importantly, one of the key factors that explains variation in nonviolent suicide rates is social approval. Suicide is a moral and legitimate way of ending one's own life. Okay, on the other hand, a major finding is that firearm ownership rates appear to be significant statistical predictors of the distribution of public mass shooters worldwide. Many of the nations in this study ranked highest in firearm ownership also ranked highest in public mass shooters per capita. For example, Small Arms Survey lists United States, Yemen, Switzerland, Finland, and Serbia as the top 5 countries in civilian firearm ownership rates, and all 5 countries also ranked in the top 15 in public mass shooters per capita. So if you look at these graphs that are extracted from this study, you see mass shooters on the y-axis and number of guns on the x-axis. You see America is a major outlier in both. So America has close to 300 million civilian guns and close to 90 mass shooters, close to 100, so 90 mass shooters. If you adjust for population, it looks a little bit less outlierish, but America is still an outlier with close to 100 guns per people. And then about 29 mass shooters per 100 million people. The second is Yemen. And then you see that there is this kind of correlation here. And then if you look at firearm rates, America has 120 firearms per 100 people. Next is Falkland Islands, then Yemen, New Caledonia, Serbia, and it goes down from there. Average is 10. So America has about 12 times the number of firearms and about 10 times the number of mass shooters than average. So they seem to correlate very closely. Now, America has more guns than people, more guns in civilian hands than there are population. Now, this doesn't mean that every American has a gun. In fact, only 20 to 30% of Americans actually own a gun. So that means that these people are owning more than one gun because all the 70 to 80% of Americans own 0 guns. However, the most interesting thing is that there's this group of super gun owners. So 3% of American adults own 133 million firearms. That means just 3% of the population owns about half the guns. And their average collection is 17 guns. They range from 8 to 140 guns according to the survey. So the distribution of gun ownership in America is not uniform. It's highly skewed. So there is some research that shows that policies do reduce gun deaths. Handgun waiting periods have reduced gun deaths. Waiting periods that delay the purchase of firearms by a few days reduce gun homicides by roughly 17%. Our results imply that 17 states, including the District of Columbia with waiting periods, avoid roughly 750 gun homicides per year as a result of this policy. Expanding the policy waiting period to all of the U.S. states would prevent an additional 910 gun homicides per year without imposing any restriction on who can own a gun. So just this waiting period has saved lots of people's lives from a public health standpoint. This was a very good paper by Dr. Wintemute on how to stop mass shootings. And this is just a perspectives opinion paper. And he's talking about the recent mass shooting events at the time he wrote it, and this was back in 2018. All right, so he talks about these policies. The better known with policies is the requirement that firearm sales involve a background check on purchasers. Background check policies work at the population level to prevent firearm purchases by felons and people convicted of certain violent misdemeanors and others who had increased risk for violent behavior. The specifics vary from state to state. Using background checks to prevent such persons from acquiring firearms is associated with a reduction of at least 25% in their incidence of arrest for firearm-related or other violent crime. So this is a federal policy. However, there's a way around it. Transactions between private parties are exempt from the background check requirements, and 22% of all firearm transfers nationwide proceed without a check being done. This is the gun show loophole. Comprehensive background check policies remove this exemption and require most private party transfers to be routed through a licensed retailer so that check may be conducted and records kept. So he feels like this is a major problem, that you can bypass this background check very easily. Recent research suggests that background check policies, as commonly designed and implemented, fall short of their effectiveness when it comes to reducing population level rates of violence. The findings do not support a conclusion that background check requirements are fundamentally ineffective. Rather, they highlight the consequences, such as the breakdown in communication reporting that led to the Sutherland Springs shootings, of specific and widespread defects in design and implementation, which have been well documented for decades and which can be overcome. So because there's so many loopholes and ways around this background check, it doesn't mean the background check policies don't work. It just means that they're not being implemented well. Perhaps the most important is that information would prohibit high-risk people from purchasing firearms is frequently not reported. So what it's saying is there's a lot of things that would prevent certain people from being able to purchase a gun, but it's not even reported. So even if you ran a background check on them, nothing would show up. The Air Force alone has apparently failed to report tens of thousands of prohibiting events, and its reporting has been the best amongst all branches of the military. So if someone had some violent occurrence during their military service, they would probably need to report that so that it would show up on a background check. However, the Air Force has failed to report tens of thousands of these events, and they're doing better than the other branches of the military, which are failing to report even more. Remarkably, other than for federal agencies, reporting of such events is not required. So we currently don't have a law that requires everyone to report these events. Since the Supreme Court decision in the Prince versus United States, a federal mandate for state and local agencies to report prohibiting events to the federal government has been seen as unconstitutional. States, however, remain free to impose such mandates. So at the state level, they could mandate this, but most states are not mandating these reporting. Other substantial built-in barriers exist. Classes of people who are prohibited from purchasing firearms are defined vaguely and anachronistically under U.S. law. Adjudicated as a mental defective or committed to a mental institution, and unlawful user of addicted to or any controlled substance are good examples. Not surprisingly, there can be serious ambiguity about whether a specific event is in fact prohibiting. Non-compliance and lax enforcement is common. Because the definitions are so vague, it's very hard to enforce, so people just don't enforce it and are non-compliant with the background checks. The second policy that could prevent firearm-related deaths is to allow courts to have firearms temporarily removed from people who pose an imminent hazard to others or themselves, but are not members of a prohibited class. So let's go back and go down to what he says. He says this is his proposed actions to prevent firearm violence. Improve background check policies. Require background checks for private party transfers. Require state and local agencies to report prohibiting events. So like if a state or like a local police department or some other social services event finds that someone is probably has violent tendencies, they should report them. Fully implementing the existing federal background check requirement. So yeah, there is a requirement, it's just not being enforced. Clarify definitions of prohibiting events. So they need to define what are these things that people feel are dangerous. So we need to get better research into that and figure out what those are and then define those better. Strengthen enforcement efforts, consider a permit to purchase approach, prohibit release of firearms until background checks are completed, and enact gun violence restraining order policy. So this is basically saying even if you legally own a gun, if you've made some comments saying that you're going to shoot up a school or something like that, there may be restraining orders to remove guns from your possession for a period of time until at least several weeks until they figure things out. Currently, those laws do not exist in many states, in most states, in fact. Congress, at a bare minimum, can bring the language of relevant statutes into the 21st century, enforce existing reporting requirements for federal agencies, and continue to support state efforts to mobilize and submit their records. A responsible Congress, I believe, would also enact a comprehensive federal background check policy, not one restricted to gun show sales or other special circumstances and give it teeth. Mass shootings are changing the character of public life in the United States and creating unprecedented demand for action. The policies described here are not gun control, whatever that term means. They uncouple harmful behavior from its consequences and help preserve our fundamental right to live safely in a free society. So I think these are things that most people, common sense, believe in. Like, people that are dangerous or have a high propensity to be dangerous should not have access to guns. Violent criminals, people that have active drug addictions, and people that have a previous history of violent tendencies shouldn't have access to guns. And then people who are otherwise legally can have guns, but have a crisis in their life and are deemed by their family or friends or local enforcement agencies to be dangerous should have their guns removed at least for a while until they kind of return to normal. The last thing I was kind of thinking about, because of the shooter in Texas was an 18-year-old, there is research that says that, and we know most of these mass shooters are young men. Um, the reason is that in adolescent brains, the limbic system develops before the prefrontal cortex, and the limbic system is their reward and emotional center. So that develops faster before their executive functions, the prefrontal cortex, which lets them reason out things uh, better, is fully developed. And most people believe that that doesn't occur until the mid to late 20s. So there may be maybe we should restrict people under the age of 25 from getting guns as well. And people are going to say, oh, well, we give guns to people in the military at age 18. However, they don't understand that in the military, that's under a highly supervised setting. Um, the military is a very hierarchical and highly supervised setting, so that's a totally different beast. Okay, well, I hope that this information was interesting to you guys. I think it's a very important topic. It's a very important public health topic. And gun violence is obviously becoming more and more of a problem in the United States. And I believe that we need to do whatever we can um, that's reasonable and backed by the data to try to prevent as much of this as possible.